Dr. JP, can you tell me about the today's roundtable conference?
Mahesh, as we all know, healthcare is one of the most neglected sectors of India, causing enormous devastation to the poor in particular, but to the country in general. But the good news is that A, the government is very alive and sensitive. A lot of efforts are going on in a variety of ways. B, we have inherent strengths in the country, the manpower, the pharmaceutical sector, the demand side being very strong in the country, the people's urge increasingly, and some states are taking the initiative, and they're also getting the political support and recognition for this good work. So the time is right now to transform this. What we come up with is basically a viable model in line with the government's thinking and the political parties' thinking, but with three specific features. First, it must be a feasible one. If it's something outrageous, it cannot be integrated with the existing programs and schemes and the structure. Then it will not happen. We are a democracy. We are a very complex and large country. We have cooperative federalism, union and states, many players, and the profession is there, regulatory bodies are there. So we have to make it feasible. B, we must make it effective. Whatever grand idea we might have, unless there's actual impact and outcomes and satisfaction of the people, and therefore the support and the feedback, positive feedback loop, it's of no use. And C, it must be affordable. India is in a very critical stage in terms of the fiscal imbalances or capacity to spend money. Many countries spend a vast amount of money on healthcare. India cannot afford to spend vast amount. We certainly have to spend more than what we are spending, but we cannot ask for the more. Some such model is being now worked out by a lot of stakeholders. And the government also is looking at something of this kind, looking for something of this kind. And I think today we had a very productive discussion with many stakeholders, experts, international organizations, people who work for a lifetime. A few of our colleagues working abroad, they came at their own expense. They're working very hard with overseas Indian teams to see how best we can integrate the best features of the models elsewhere in the world. So I think we have a sense of what works, what doesn't work, and how to integrate it, and how to make the model better. And on the basis of the feedback, we'll now improve the model and make a presentation to the Niti Aayog initially and eventually the government.
Dr. JP, what will be the next course of action and how do you think volunteers can contribute to this effort?
On the 25th, that is day after tomorrow, Monday, we are meeting the Niti Aayog and making the presentation to them. But this presentation will be an improved version on the basis of the feedback today. And once there is a general, in principle, agreement with a broad approach that we need to follow, it must be sufficiently different from current approach in order to actually bring about a changed outcome. It must be sufficiently capable of integration. It must be affordable again. So once there is that perception, with improvements that Niti Aayog might suggest, we will then take it to the public at large. But more important, healthcare in the best sense of the term is an intensely political issue. Therefore, unless the media, civil society, the people who understand the healthcare sector, and the consumers of healthcare, the people who are suffering for long and a lot of out-of-pocket expenditure, unless they all understand what kind of answers are possible, and unless they say that this is the kind of thing that the people want, unless those in government and political parties realize that there is actually public support for this kind of an approach, it's not easy to take forward. If it merely happens in a bureaucratic way, along with the multiplicity of skills we have in various sectors in the country, this becomes one other program that doesn't really take us far. It must be something like National Health Service in Britain, and they constituted that. Something similar, by whatever name we call it. And unless there is political ownership and credibility politically, this will not happen. Therefore, the highest level in government now, they must take note of it. They must own this. It's their program. It must be their legacy. It must be very legitimately giving them the satisfaction that they've done something right for the country and the people. Therefore, it is for us in the civil society and media to generate a meaningful debate, to perfect this, and also to make it work. Because our experience taught us, no matter how wonderful a model is, no matter even if you get laws enacted and even constitution amended, Unless the people are involved, unless they understand it and they know what are the stakes, and unless they know how to operate the system, things will not improve in real terms. And healthcare is so intensely personal issue and so intensely political in the best sense of the term. And so many people are suffering so much for want of healthcare in this country. For instance, we all know that about 6 crore Indians every year are falling below poverty when they were slightly above poverty earlier, only because of healthcare costs. Because there's a lot of expenditure out of pocket, and the system has not really ensured delivery of healthcare without their having to spend in private sector. And given this fact, and also the fact that increasingly you find in private big corporate hospitals, the last 1 month of a person's life, people are forced to spend a lifetime's savings. Oftentimes, if it's an intractable disease, inoperable cancer or something, doctors are not gods. But a lot of money is spent there, largely because the primary care is neglected, preventive care is neglected. A system of a general practitioner, family physician, and then the first level of referral, and then tertiary care in an orderly manner. It's simply absent in the country. So people are spending a lot of money. A bit of it government is spending, but we're not getting the benefits. And everybody in the country, rich and poor, and particularly poor and middle classes, they feel the pinch, they feel the pain of bad healthcare system and high cost healthcare system, which is neither giving us satisfaction nor good health. So unless we make it a national debate, this cannot happen merely because of signatures of a few people.
Okay. Thank you, Dr. JP.